Welcome to my YouTube channel. In this video we will talk about liver transplantation. Before going to the video, make sure you hit the like, share and subscribe button. What is a liver transplant? A liver transplant is a surgical procedure to replace a failing liver with a healthy one that comes from another person's body. You can receive a whole liver from a donor who has recently been pronounced dead, or you can receive a part of a liver from a living donor. A divided liver can grow back to full size in both your body and the living donor's body. Why would someone need to have a liver transplant? You can't live without a functioning liver. If your liver is failing, or if you have primary liver cancer, a liver transplant could save your life. Many things can cause your liver to stop working, including immediate, acute causes like toxic poisoning and chronic liver diseases. There are many more people who need liver transplants than there are donor livers available. What conditions can a liver transplant treat? Liver transplant surgery is usually reserved for 1. Liver failure, acute or chronic. 2. Primary liver cancer, hepatocellular carcinoma. It's usually a last resort treatment. The competition for donor livers is high, and even if you do get one, it won't always cure the underlying disease. Some chronic liver diseases will simply resume their destructive work on the new liver. But since these diseases tend to progress slowly, starting over with a healthy liver can buy valuable time. Primary liver cancer. The type of cancer that begins in your liver is called primary liver cancer, or hepatocellular carcinoma. If cancer doesn't spread beyond your liver, removing the liver can remove cancer and cure it. Sometimes your provider can remove just a piece of your liver with the tumor in it, partial liver resection. But if your liver is in poor condition, a transplant may be necessary. How long can you live without a liver transplant? If you have acute liver failure, you may recover, but this is unpredictable. Those who don't recover may die within days. Chronic liver failure is a more gradual process. You can live with cirrhosis for months or years while waiting for a liver transplant, although the need becomes more urgent when complications, such as portal hypertension, begin to develop. If you're waiting for a liver transplant to treat primary liver cancer, cancer itself may still be in the first stage. Liver transplant surgery is only a treatment for liver cancer if it hasn't yet spread beyond your liver. However, most people with primary liver cancer also have chronic liver disease. As a result, your outlook depends on many individual factors. How common are liver transplants? Around 8,500 people a year receive liver transplants. Around 12,500 people each year are added to the donor wait list. Almost all, 95%, liver transplants are whole livers from deceased donors. However, partial transplants from living donors are on the rise. The number of living donor liver transplants performed in 2019 was 30% higher than in 2018. Procedure details. What are the criteria to qualify for a liver transplant? There is a high demand for liver transplants, and not everyone who wants one will get one. Those who do will have intensive surgery and recovery. Healthcare providers want to do everything they can to ensure that the transplants they perform are successful. That's why they require that you meet certain criteria to qualify for a liver transplant. The minimum requirements to qualify for a liver transplant are 1. That you have clinical signs of liver failure or primary liver cancer. 2. That you are well enough to have the surgery and recover well. 3. That you are not considered at risk of future alcohol or drug abuse. There's a lot involved in determining these things. Healthcare providers will fully evaluate your physical and mental health and any history of chemical dependencies. If you have any compromising conditions, these will need to be treated first. Once you meet the minimum criteria for a liver transplant, you'll be placed on the national waiting list. How are donor livers matched with transplant recipients? The liver transplant waiting list isn't only sorted by need. It's also sorted by 1. Blood type. 2. Body size. 3. Geography. Having a compatible blood type helps to prevent your body from rejecting the donor liver. Sharing a similar body size helps to ensure that your new liver will be the right size for your body. And being in the same geographical region helps to ensure that your donor liver will have time to be delivered to you while it's still viable, within 8 to 9 hours. In order to be a match for a donor liver, you usually have to be a match in all three of these categories. For urgent need, you might receive a liver from up to 500 miles away if one becomes available. Most of the time, the whole liver is matched to one recipient, but occasionally, healthcare providers are able to identify two candidates who can share one liver. How much liver is needed for a liver transplant? Most adults need only one liver lobe, hemisphere, from a donor. If the donated lobe is healthy, it will regenerate to its former size. Surgeons often select the right lobe for transplant because it's a bit bigger, but in a pinch, the left lobe will do fine too. Most children only need about 20% of an adult liver, which is about the size of one of the left lateral segments. Where do donated livers come from? A liver that's viable for transplantation must be fully functional. That means that none of the tissues have yet died. Tissue death occurs when blood flow is lost. So, donor livers come from bodies that still have active blood flow, whose hearts are still beating, but whose brains have died. Often, they've had a catastrophic injury to their brain. Sometimes the person has agreed in advance to donate their liver under these circumstances. Other times, their family donates the liver on their behalf. These circumstances, and the identity of the donor, remain confidential. Healthcare providers will evaluate the health of the donated liver and test it for any infections before matching it to a waiting recipient. How does living liver donation work? You can skip the liver transplant waiting list if you are able to obtain a living donor liver transplant. This is usually a friend or family member who shares a similar body size and compatible blood type and has volunteered to donate a portion of their liver to you. Occasionally, an altruistic individual who may be entirely unconnected to you becomes an anonymous donor. Living donors are thoroughly screened before they are approved for the procedure. Healthcare providers evaluate their overall health and fitness for surgery, as well as the condition of their liver. They'll make sure the potential donor fully understands the risks of the procedure and that they are psychologically prepared for the commitment they're making. One advantage of having a living liver donor is that you and your donor can schedule the surgery together in advance. You'll have surgery at the same time. You'll also have the advantage of having your liver transplant sooner than most. This makes it more likely that you'll receive a healthier liver, and also that your health will be better off for surgery and recovery. How serious is liver transplant surgery? Hepatectomy, removal of part or all of the liver, is considered a technically difficult surgery. One reason is that the liver bleeds a lot, so liver surgeons have to be trained in special techniques to manage the bleeding. People with liver failure tend to bleed even more because blood clotting to stop excessive bleeding is one of the liver's jobs that it has stopped doing well. You may need multiple blood transfusions during your operation, which can take between 6 and 12 hours. The length of the operation also raises the risk of possible complications, both during and after the procedure. Afterward, you'll be under close observation for at least 24 hours, and you'll stay in the hospital for 1 to 3 weeks after that. What happens during liver transplant surgery? Liver transplant surgery is a major operation that will take between 6 and 12 hours. You'll be asleep under general anesthesia during the surgery. For this kind of procedure, surgeons install a variety of tubes in your body to carry out certain functions while you're unconscious. The tubes will remain in place for a few days after your surgery. You'll have 1. An IV, intravenous catheter, in a vein of your arm or hand to deliver fluids and medicine. 2. An IV in a vein of your neck or thigh to monitor your blood pressure and take blood samples. 3. A tube through your mouth and into your windpipe attached to a mechanical ventilator. 3. The ventilator will expand your lungs mechanically to make sure you keep breathing during surgery. 4. Tubes in your abdomen to drain blood and fluid from around your liver. 5. A nasogastric tube inserted through your nose into your stomach to drain secretions from your stomach. 5. It will remain in place for a few days until your bowel function returns to normal. 6. A catheter in your bladder to drain urine. 6. What happens after liver transplant surgery? You may remain in intensive care for several days following your surgery. Your healthcare team will monitor your condition and watch for signs of complications. They'll take blood samples to check how your new liver is working. They may need to actively manage your fluid, electrolyte balance, blood sugar levels and blood volume through your IVs. When your condition has stabilized, your tubes will be removed and you'll relocate to a recovery unit to continue your stay for another 1 to 3 weeks. Your bowels will take a few days to begin working again. You'll begin drinking liquids and slowly reintroduce solid foods. You'll slowly begin to wean from your IV pain medication before going home. Risks, benefits. What are the possible risks or complications of liver transplant surgery? The most significant risks from the procedure itself include 1. Blood clots. 1. Liver transplantation is a longer surgery, and the longer you are on the operating table, the greater your risk is of blood clots. 1. The risk is still less than 5%. 2. Hemorrhage. 2. The liver bleeds a lot, especially when you have a blood clotting disorder due to liver damage. 2. Liver surgeons expect this and often use automatic blood transfusion technology. 3. Bile duct injury. 3. Injury during surgery could cause bile to leak into the abdominal cavity, which would be toxic. 3. After surgery, scar tissue can develop where your bile ducts were injured and create a stricture or blockage, causing bile to back up into your liver. 4. Liver failure. 4. Sometimes the donor liver is damaged in transit and fails to function after transplantation. 4. If this happens, you'll need a new donor liver to replace it as soon as possible. 4. This occurs in about 5% of cases. What kinds of problems might arise after a liver transplant? The most significant post-operative complications of liver transplant are organ rejection and infection. Organ rejection. Your healthcare team will prescribe anti-rejection medications, immunosuppressants, to help prevent your immune system from attacking your new liver. Even so, mild rejection episodes are common in the first year after your transplant. Acute organ rejection occurs in 25% to 50% of all liver transplant recipients within the first year, with the highest risk period being in the first 4 to 6 weeks after transplantation. The first evidence of acute organ rejection usually comes from elevated liver enzymes in your blood test. Your healthcare team will confirm the diagnosis with a liver biopsy, a simple bedside procedure using a needle. They'll treat it by adjusting your medications. About 5% of people may have chronic organ rejection, repeat episodes that continue despite medication. Chronic organ rejection may eventually cause your new liver to fail. 1. How long can you live after a liver transplant? This depends on many factors, including your age, overall health status, and the original liver disease that caused you to need a liver transplant. In some cases, that disease may return or continue. The average survival rate after liver transplant is 75% after 5 years and 53% after 20 years. Thanks for watching the video. Make sure you hit the like, share, and subscribe button.